Live breaking news from your local news channel.
Good afternoon, and thanks for joining us for this special report. I'm Janelle Padilla. The Santa Barbara County Public Health Department is providing its weekly update on the COVID-19 pandemic. Let's listen in.
Temperatures were extraordinarily hot this past weekend. According to local news reports, Solvang reached 122 degrees on Sunday. Lompoc hit 110 degrees. It was 106 in Carpinteria and 103 in downtown Santa Barbara, northern Goleta, and Santa Maria. Temperatures at the official reporting stations at the Santa Barbara Airport and at the city of Santa Maria matched and exceeded the highest temperatures ever recorded at those locations since official records have been kept. It was very, very hot, and despite the difficult and dangerous conditions, the overwhelming majority of local residents responded appropriately and respected the public health order regarding beach restrictions. Unfortunately, not everyone was as respectful as we'd like, but crowds were far below what would normally occur on a very hot Labor Day weekend. Visitors from out of county largely stayed home and didn't overwhelm our local beaches. Considering the usual options for keeping cool on hot days like going to the movies was not an option this year, I consider the level of compliance with the public health officer orders to be a success. Thank you to everyone who suffered through the heat and still stayed home. The beach access restrictions were enacted to reduce the possibility that out-of-town visitors would come to local beaches in large numbers and create overcrowded conditions that could increase the community spread of COVID-19. This objective was met. We're continuing to make progress on slowing the spread of COVID-19 in our community. Although we have not yet reduced our positive COVID-19 cases enough to move from the governor's purple tier to the less restrictive red tier, we are making progress. On August 31st, our county's 7-day average case rate was 9.0 per 100,000 population. Today, the California Department of Public Health announced our first official report card number in the new color-coded data system as 8.3 cases per 100,000 population. We need to lower our 7-day positive case average to 7 per 100,000 population to move to the red tier. The other metric the California Department of Public Health considers is the test positivity rate. Santa Barbara County's reported test positivity rate today is 5.5%, well below the standard for the next tier. If we all continue to be extra vigilant, we can keep this positive momentum going in the right direction and move to the red tier by the end of September. The state of California's Unemployment Development Department has begun issuing $900 supplemental federal unemployment insurance payments to jobless Californians. The lump sum payment covers 3 weeks of benefits retroactive to the week that ended August 1st at the rate of $300 per week and is paid for by the federal government. On Monday, the California Labor Secretary announced that the state has received federal approval for an additional 2 weeks, or $600, bringing the total benefit to $1,500. The Employment Development Department announced Monday this additional $600 benefit on top of the $900 will be sent out later than this week's initial first payment. The Federal CARES Act provided a $600 supplementary benefit on top of normal state unemployment insurance, but that program expired in July. Congress and the White House have still not reached an agreement on an extension of the federal unemployment insurance supplemental payments. An executive order by the president last month authorized $300 in weekly supplements for a limited period of time. The uncertainty surrounding resumption of these critically needed supplemental unemployment insurance benefits has created tremendous hardship for the millions of Californians who are unemployed because of the economic impact caused by the COVID-19 pandemic. Congress must act quickly to resolve this issue to protect the small positive gains that are beginning to appear in our national economy. Fire safety is also extremely important right now, especially this time of year when the record high temperatures we are experiencing. I want to take this opportunity to thank the men and women of the Santa Barbara County Fire and Sheriff's Department for their very quick and decisive response to the wildfire that began yesterday in Miguelito Canyon, south of Lompoc. The fire burned more than 25 acres and had the potential to grow than more than 200 acres, but the fast action of Santa Barbara County firefighters was able to stop the spread of the flames. Wildfires Earthquakes and other disasters can strike at any time, including in the midst of the COVID-19 pandemic. Please remember to be prepared to follow the Ready, Set, Go fire safety guidelines to protect your family from the risk of a very quickly spreading wildfire or other natural disaster. Ready is prepare yourself, your family, and your property. Set, you should monitor fire activity and prepare to evacuate. And go, please leave early when directed by public safety officials or even when you feel uncomfortable about your own personal safety. Register at sbc.org to receive updates. If we can't reach you, we can't alert you, so please register at readysbc.org. Next, we have Dr. Vondo Reynoso, Director of the county's Department of Public Health.
Thank you, Supervisor Hart. Today, we are reporting 3 new cases and an additional 138 over the weekend. We currently have 216 cases that are still infectious in our community. Our reported cases for today are low because of the holiday weekend. We also double-checked our testing volume for yesterday, and overall, it was also low. We anticipate more lab results will trickle in over the next few days, and our case numbers will stabilize to what we were reporting before the Labor Day weekend. And we saw similar situations with the Memorial Day weekend and 4th of July. Currently, 44 people are hospitalized with 17 in the ICU. Our total case count stands at 8,499 today. Our daily status report and county surveillance metrics are updated on our website if you wish to see more details. These reports and metrics will now be updated by 3 p.m. Monday through Friday. As Supervisor Hart mentioned, earlier today, the California Department of Public Health released tier assignment for counties based on case rate and percent positivity. For the September 8th assessment, Santa Barbara County has been assigned to the purple tier based on an adjusted case rate of 8.3 and 5.5 testing positivity rate. As you may recall, even though our test rate is in the red tier, our adjusted case rate is in the purple tier, and the tier assignments are made based on the more restrictive tier. Our numbers are reflective of our individual and collective action. We need concerted efforts to decrease the disease transmission in our community. Everyone in our community needs to commit to wearing your face covering, maintaining physical distance, and limiting gatherings and crowds so that we can move into the next tier. Partnering with community agencies is key to our goal in reducing disease transmission. The county and UCSB have met on several occasions these past few weeks to address the issue of gatherings and students' return to the area. We support the decision by the university to not hold in-person classes for the fall. We applaud the action by both UCSB and SBCC in sending letters to their students, alerting them that they will be held accountable for violations of the health officer orders and any violations of the student code of conduct. The county, UCSB, and IV stakeholders will collaborate on a new targeted outreach education campaign. Outreach ambassadors will continue to be in Isla Vista to provide education and masks. They do not approach party or gathering in progress, but will proactively provide information on health and safety during COVID, which is to avoid gatherings and the need to wear face covering when in public. The Public Health COVID-19 team and UCSB student health team are in weekly contacts regarding disease containment and testing. Public Health intends to partner with the university to do pop-up testing in IV so that we can test, trace, and box in the disease. These are examples of what we are doing to address disease transmission in Isla Vista. In closing, thank you for being our partner by doing your part to keeping our community safe.
Thank you, Dr. Reynoso. Dr. Lynn Fitzgibbons, Cottage Health's infectious disease specialist, is also here today to talk about COVID-19 testing.
Thank you, Supervisor Hart, and thank you for the opportunity to connect with you all today. Throughout the epidemic, clinical aspects of care for COVID-19 have really continued to evolve and develop at a remarkably fast pace. Monthly, weekly, even daily, we learn more about how to treat, how to prevent, and the reason I'm here today, how to diagnose this infection. As we enter the fall and the winter, efficiently and correctly finding the patients who have this disease will be a cornerstone of our ongoing public health response. Our ability to diagnose COVID-19 begins with a thoughtful and thorough evaluation of a patient's likelihood of having COVID-19. For example, do they have classic signs and symptoms of COVID-19? Or do they have a close household contact with a confirmed case? If either of these are true, then our suspicion for infection goes up significantly, and testing would be strongly recommended. But then we ask which tests should be used. And we have 3 general categories of tests at this point. It's very important, particularly now as the fall approaches, for us to understand the differences. The first test type are the PCR or molecular tests. These are the tests that have been around. These are the tests that are the gold standard for whether or not someone has COVID-19. The PCR test is usually done with a swab of the nose or the throat, but can also be done on saliva. When a positive PCR test confirms the diagnosis, we now know that the PCR can actually stay positive in that patient for up to 3 months, even though the patient, may stop being infectious to other people 10 or perhaps 20 days after their symptoms began. In other words, the PCR is used to diagnose a patient with COVID-19, but isn't very helpful after their illness, as it can stay positive for weeks or months, even though that patient is no longer contagious. The second important test type, and the one that's gaining a lot of interest in the last couple of weeks, is the antigen test. Remember that the PCR is testing for bits of RNA, bits of the blueprint of what makes the virus. The antigen tests are different. They're looking for actual proteins. They're looking for the building blocks of the virus itself. The antigen tests, similar to antigen tests that we've had for many years for influenza, are usually quicker, cheaper, point-of-care tests. They can be done right there and then and give a result within 10 or 15 minutes. Unfortunately, the antigen tests generally have lower sensitivity than the PCR. In other words, there may be a small percentage of people who have COVID-19, but when we do an antigen test, the test may be wrong and say that they're negative. For this reason, it's usually recommended that negative antigen tests are followed up with a PCR to confirm that a negative is really a true negative. This also means that the antigen test will be excellent for quickly confirming most people who are positive. But again, those who have a negative result will need a second test. At this point, there are approximately 4 types of antigen tests on the market, one of which, getting a lot of attention, is marketed by Abbott, called the Binax Now. It's been set at a very low price point, and massive production has been anticipated with tens of millions of kits available by early October. We understand at this point that the majority of these test kits, the Abbott Binax Now, are being purchased by the federal government, distributed to states, and the allocations will occur through the state health department. The final important test type to mention would be the antibody tests or serologies that we've all talked a lot about. These tests, remember, are simply looking for evidence that a person's immune system recently saw this virus. Antibody tests turn positive after an infection or at the very end of an infection, and therefore clinically, we don't use them to diagnose someone who is sick or an acute infection. We look forward in the future, I think, to learning more about whether people with a positive antibody test are protected from catching COVID again. And if so, how long does that last, that protection? But at this point, we simply don't have that information. Finally, a few comments from what we're seeing on the front lines. From an infectious disease perspective, there has been a very, very positive trend in the hospitals throughout the county over the past few weeks. By following the number of patients hospitalized with this infection, we get a very accurate view of our community's condition. But unfortunately, it is a delayed view. When I see numbers going down at Cottage and around our county, I'm thrilled to know that our community's strong actions led to this downturn. But the actions that lead to my patient being discharged today, tomorrow, or perhaps Thursday, that case was a result of a transmission event that occurred perhaps 2 to 4 weeks ago. In the wake of an incredibly hot and difficult Labor Day, I'm hopeful that our community's good practices held strong, as Supervisor Hart indicated, and that our numbers continue to trend downward. Only time will tell, and now is the time again to stay vigilant. Please, please, please take care of your health now. Get an influenza vaccine, and think about ways that you personally can enter the flu season as healthy and safe as possible, so that you and your loved ones can stay out of the hospital. Thank you, Supervisor Hart.
Thank you very much for joining us today, Dr. Fitzgibbons. Kelly Hubbard, Director of the county's Office of Emergency Management, is also here to talk about the county's COVID-19 Business Ambassador Program.
Good afternoon. Thank you, Chair. I'm here to talk a little bit about the RISE Ambassador Program. The RISE Ambassador Program is really our proactive educational outreach program to support local businesses and our Santa Barbara community with reopening safely. We acknowledge that the process and rules from state and local government and various entities can be confusing when businesses are looking at how to reopen. Information can continue to be found at www.recoverysbc.org. Information there, if you click on Reopen Your Business, can help a business identify how to reopen safely, including steps to reopen, reviewing state and local guidance, completing a COVID-19 response plan, and self-certifying that they can open safely. The Ambassador Program started back in May with some volunteers from the Community Wellness Team, led by Suzanne Grimacy, of which many in our community know. The program was popular and I think helpful into the community, and so we have expanded that with CARES funding support, and now have a team of county employees, 5 ambassadors currently and a county lead, possible expansion soon, to help the community and our cities with additional ambassador program. We have city and community teams. A couple examples, Goleta CERT, recently in the news, excellent outreach with over 100 business contacts in the last couple of weeks. We also have cities of Santa Barbara, Lompoc, Santa Maria, and Carpinteria all joining in and receiving training, all led through our county ambassador program. What does the county ambassadors do, the RISE ambassadors? First and foremost is business outreach. They are working to reach out to businesses, support them, give them guidance in the business attestation process and how to reopen safely. This includes providing supportive signage, helping to interpret the various measures, protective measures that they may need to put in place in their business, general education, and answering questions. Outreach is also based on some of the complaints we receive. So ambassadors do get some of those complaints that we receive from the community, and they do help to outreach to those businesses. Outreach is always education focused first. That is our first and foremost priority, to make sure businesses understand what the steps are. There are multiple methods or approaches, and so ambassadors may reach out to businesses through phone calls, in-person visits, or letters or mailers that they may receive in the mail. Additionally, the ambassador team is going to start doing individual outreach on encouraging safe social behavior. You may see this at a street booth, for instance, down in a primary area of town where maybe there's a lot of businesses or restaurants. They might set up a booth, have some information about how to continue safe practices, remaining diligent about wearing your face covering, observing social distancing, helping to answer questions, and even offering some face masks or face coverings for the public who may not have them. The ambassadors also coordinate with our overall compliance efforts, and so this includes working with our Compliance and Code Enforcement Task Force. This task force involves representatives from many of our agencies in the Santa Barbara County, including our ambassadors, Environmental Health Services, City Code Enforcement, and state regulatory agencies such as Cal OSHA or the Alcohol and Beverage ABC. that coordination is still based on education. And so even with those outreach and enforcement agencies, the first priority is education. And as we continue on and we have multiple outreaches to a business, then we may move into some administrative or civil enforcement. That is not the ambassador's role, but they work closely with those other partner agencies I mentioned to help with that enforcement. Overall, you may see RISE ambassadors out in the community 7 days a week. They will have these very nice blue shirts that say RISE across them. It'll be easy to identify. Some of our city partners may also use their own city logos, but they may also have RISE ambassador shirts. And if you are a business who has questions or concerns, you can reach the RISE ambassadors by calling 805-681-5508, or you can email them at riseambassador@countyofsb.org. Additionally, lastly, if you do have a complaint about a local business or area, you can file a complaint at recoverysbc.org. You scroll down to the bottom there, and there is a complaint form that can be utilized. Thank you very much.
Thank you, Ms. Hubbard, for that important information. We'll now go to questions from the room. Ms. Lair.
Thank you. When she was talking about complaints, we've had people send video of parties to our newsroom saying, what do we do? There's not really an ambassador that I know of in Isla Vista, but it seems like neighbors are telling on neighbors, at least to the media, of parties on Del Playa, including one with the Bounce House 2 weekends in a row. And then you guys are reaching out to UCSB and they're saying repercussions, and we're wondering what kind of repercussions would the Public Health Department like to see?
Well, number one, the parties with the Bounce House are a really terrible idea, and we are going to make sure that that particularly multiple offending location, gets contacted, and that there are the clear connection with the university, if that's the case, is made, and that the potential consequences to those repeat offenders occur. But it is important to recognize in context that there are 450,000 people in the county of Santa Barbara, and the vast, vast majority of them are doing a really excellent job of following the guidance, and that conformity is increasing over time. If you go out in public on State Street or some of the other areas where folks have brought this up as an issue, there is a much higher level of compliance happening today. And that is because I think people are understanding increasingly the consequences of not doing that on businesses and on schools and on our community, and are responding appropriately. Of course, it's not 100%, and we did have some mistakes happen at the beaches, and as you described in Isla Vista, that's occurring unfortunately behind closed doors in other locations, but we just want to continue to reemphasize and encourage people to take responsibility for themselves and for protecting others. That's what this is really about, is protecting each other from potentially contracting the virus and the consequences from a health standpoint that would occur from that.
Can I also ask Dr. Lynn Fitzgibbons, what kind of tests would go into, or what would be helpful in Isla Vista if students possibly are asymptomatic or something to that effect? And if you get into that red tier, what does that mean exactly to the community?
So I can take the first part of the question, and I'll turn to Dr. Donoso for the second part of the question. So I think the question is, how do we test within a community where we suspect there is transmission, perhaps a lot of asymptomatic transmission? And without getting into very detailed specifics, I will just give a shout out to the leadership across the UCSB campus that has been, I think, working diligently for months on a variety of efforts related to exactly this concern. There have been incredibly large-scale surveillance efforts happening on campus. There is ongoing excellent work happening, again, through the Student Health Service, but also through other aspects of campus, really addressing your question, making sure that we are looking for this disease even in people who may not have, florid symptoms. And then lots and lots of very, very clever people working on a variety of other really unique, interesting ways to perhaps survey for this disease too. When there is a confirmed case or a suspected case, I would say that whether it's a student who gets care at the University Health Service, whether it's a community member living in Isla Vista, really under the care of one of our FQHC's clinics, or even the Public Health Department testing. I know there has been a lot of testing, and that's why we know that there have been cases in Isla Vista. And so I would say, I'll just conclude, testing in Isla Vista, we could probably use more of it, but at this point, I really am confident that there has been a lot of really good efforts and a lot of really expansive testing in that community, and the work's not done. And I'll turn over the second question to Dr. Domas.
So if we move into the red tier, what that means is that incrementally, we can move some of the outdoor operations 25% indoors. So, and then the big thing is that schools can have the option to return to in-person education instead of going through the waivers.
Thank you.
Thank you, Ms. Lair. Now we'll go to questions on the phone.
Yes, first up is Malia Martin with the Santa Maria Sun.
Hi there. You all spoke earlier about how the county is doing as far as case rate and positivity rate. I'm also wondering how the countywide hospitalization rates are doing as far as the state's watch list threshold for that specific metric.
Hospitalization, we are trending downward just like the rest of the state. And as Dr. Fitzgibbons mentioned earlier, we are seeing that throughout the county hospitals. And so even prior to the blueprint, we were very solid in our hospital capacity to serve COVID positive patients and in general.
Thank you.
Next up, we are going to Laura Place with Santa Maria Times. Go ahead, Laura.
Thanks, sorry, just unmuted. So I checked as far as the elementary school waiver list, and it looks like that hasn't been updated for today. But I was wondering if you all knew or had received word from the state about any other schools that had received waivers in the county to reopen.
On Friday, we shared that Howard School, Knox School, Laguna Blanca, and
we're listening to Santa Barbara County officials with an update on COVID-19, highlighting progress with our 7-day average of positive cases. The county is still in the purple tier, but officials hope to move to red by the end of September. And because of the holiday weekend, low case numbers were reported today. The latest 3 new cases with 216 active cases in the community.
The school, then we will make that announcement. And the rest of the schools are in queue for processing.
Okay, and when schools do receive waivers, is that something the county will just share at the next press conference, or will you all be sending out, announcements about that, or just save it for the press conferences?
We have a press conference on Friday, so we will save it for then.
Thank you.
Thank you, Ms. Place.
Next up, we're going to Tom Bolton with Newshawk.
Oh, hi, thank you. I had some questions for Dr. Fitzgibbons. You mentioned that the clinical aspects of care have evolved quite a bit, and I wonder if you could just share with us a little bit about how some of the care in the hospitals has evolved over the recent months.
Thanks, Tom. Yeah. How long do you have? So let's go back to March. We have a novel respiratory virus. We have some information from its cousins, SARS and MERS, and influenza for that matter, that when we give steroids, people die. Take us forward now 2 months later to June, and we have results from the recovery trial from the United Kingdom, and now several other very solid publications that actually show us clearly for SARS-CoV-2, for COVID-19, when patients have low oxygen levels and need to come into the hospital, we can save their lives if we give them steroids. Just one example. When we think about medications like remdesivir, an antiviral targeting the virus, again, in April, we had the ability to use it in very rare circumstances by a very kind of dramatic last Hail Mary effort where we tried this. And, I think anecdotally we do think that back then it made a difference for some patients. We now have solid data that corroborates and supports the fact that, again, for patients who are sick in the hospital with this disease, we can save some people's lives by using this treatment. And so I think those are the therapeutic aspects of what's evolving, what's evolved, and what I look forward to, again, continuing to learn more week over week. We talked about the diagnostics, but I don't want to forget to mention prevention. It's critically important that we remember that now we know things we didn't know back then. Now we know that people who suffer from this disease, from this infection, and get better, we know that even when they're better, even when they're walking around, they may still have a positive PCR for 8 or 12 weeks. And what we also know, and again, the data just gets stronger every week, but what we also know is that that patient, after about 10 days or 20 days, depending a little bit on some of their circumstances, even if 2 months later they still have a positive test, we know they're not infectious. The final thing I'll just mention is every month that goes by, we learn more about the likelihood of someone getting it again, what we call reinfection. Thus far, the data has been reassuring within a few months of someone having a first infection that they really seem quite unlikely to catch it again. And if they do catch it again, perhaps they get an asymptomatic version or perhaps a less severe version. We don't yet know how long that lasts. Will it be a couple of years like other coronaviruses? Will it be longer? We just don't know. But I think an exciting time, and I think a lot more to come.
Thank you. Sort of a related question. I mean, clearly the county's hospital numbers have improved. They're about half what they were a month ago. I'm wondering also, has there been any changes in terms of the criteria for who gets put in the hospital and when? Great
question. We've really said for several months now that the best metric we have, the best measure we have to say how our community is doing are the hospitalization numbers. Because we really like to think that they're not affected by things like how many people are getting tested, right? The denominator effect of, for example, the percent positivity. To your point, we don't really have any change over the last several months for the criteria that doctors are using to say who gets in the hospital or who doesn't. In general, what was true back in March, April, and now, really, I don't think has changed very much, if at all. In general, people get admitted to the hospital if they have significant breathing problems, if their oxygen levels are dropping, if they, for example, have changes in their mental status or confusion related to their infection, or if any of their organ systems are otherwise not doing well. And so those criteria are all very objective, or quite objective, and that's not really changed. And that's the reason that I say, to your point, the fact that we've almost halved our county's hospitalization numbers over the last couple of months, I think is really, really a tremendous just win.
Thanks. And one last question. Have you seen any significant change in how long COVID patients are staying in the hospital?
Oh, very interesting question. We have a little. Perhaps, again, the data is hard to analyze, but perhaps a slight shortening in those who are not critically ill. When patients are critically ill, the number of days or sometimes weeks they spend in the hospital really hasn't changed much over the course of the epidemic. There has perhaps been a slight trend towards shorter stays. I personally attribute that to, again, some improvements of our understanding of this disease. I do think that steroids are helping people recover more quickly. We know that from data, but I'm seeing it too. We know that if we give people steroids, for example, or some of these other treatments that we have, we know they get better faster and get out of the hospital and feel better quicker. And so I think it's small numbers, but I do think the trend is towards shorter hospital stays.
All right. Thank you very much. Very helpful.
Sure.
Thank you, Tom. Next up, we're going to Fabiola Navarrete with Tu Tiempo Digital. Go ahead, Fabiola.
Hello, good afternoon. Okay, I just want to ask Dr. Fitzmoon, sorry for my pronunciation.
Dr. Lynn is easier.
I just want to ask about these 3 types of tests that you just talked about.
Sure.
Are these 3 types of tests already available for all the community?
Thanks. Yes, so when people have been saying over these last few months, my doctor has ordered a test, almost all of those tests have been the PCR test or the molecular test, its cousin. So the first ones I described, those are what we have been using. Those are gold standard. What's new through August was the FDA issuing EUAs, so allowing the use of antigen tests. And as I mentioned now, I think there are at least 4 of these different antigen tests available. So that is new. Again, the technology's not new. We've used influenza antigen tests for a very long time, but those are newer. And the final thing I would say that's new is the use of saliva. And so many people probably know, but you can send a home saliva kit, for example. It has FDA EUA now. I think it costs $109. And there are states around the United States where it's allowed that you can do a home saliva test and mail it off and get your results back a few days later. And so I think, as I said earlier, this is just an evolving field, and these are, it's both the type of test and the location of what part of your body you're testing that I think has really changed a lot, particularly the last 3 or 4 weeks.
Oh, okay. Thank you. That's my only question. Thank you.
Thank you, Fabiola. And that ends our questions.
Thank you very much for those questions. Our next press conference is this Friday, September 11th at 4:30 p.m. If you have any questions, please call the 211 information line. Local information on COVID-19 and access to support and services is available 24 hours a day, 7 days a week in multiple languages. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient in your interactions with others. We are stronger together, safely apart.